next question, our next talk will focus on preventing bleeding in high-level athletes, and whether that's and a physiotherapist from the Alberta Children's Hospital, and Patrick SYRIANI, who is an accomplished athlete, longtime Quebec chapter volunteer. Patrick is a patient with severe hemophilia A from Quebec who participates in sports at a high level, including CrossFit. So welcome.
Thank you, Emily. We will try to be concise so we can all go get some coffee. So this is a topic that is a bit of a hot button issue in the world of patients on Hemlibra, trying to figure out who we're switching and who we're not and how we best support our kids and adults to do what they want to do in athletics. These are my disclosures. So I want to discuss the current status of factor use for athletics and hemophilia, discuss the theoretical target factor levels for sport, and discuss the current trends in Hemlibra prophylaxis in sport. Oh boy, I can't actually read this. My bad. So essentially, over the last 10 to 20 years in Canada, there's been an increase in the amount of sport that, I didn't plan my font very well, in the amount of sport that our hemophilia patients are doing, given that we have had better access to prophylaxis and more tailored prophylaxis. The ability to assess PK has been really helpful in helping to understand how to best support our patients with their levels, and to also modify around sport to make sure that we're getting their peaks at the correct time. There's been a big push to move to shared decision making with sports. So rather than saying you may not do this, it is what do you want to do and how are we going to work together to make that happen for you, with your family, with your coaches. And generally we try to keep the factor levels higher at the peak time of sports. And many patients will choose to increase the frequency of their factor dosing around the higher athletic periods. So if they have, if soccer is more prominent for them in the summer, they may increase their prophylaxis frequency during that time period. A lot of patients will use MyWOPs to look at where their factor level is actually sitting before they play sports. However, there's not actually an agreed upon magical number factor level that patients should be at for certain sports. We just kind of guess. So there's really a limited consensus and evidence around the ideal factor levels for sport. There was a recent study published in Hemophilia in 2020. It was an expert elicitation exercise to determine ideal factor levels or target factor levels for sport. There was only 9 people that participated in this study. They used the NHF guide for sport, and that is a controversial guide because it does break down activities by low, medium, and high risk. And we know that that's not the most appropriate way to look at activities, because low risk activity for one person may be a high risk activity for someone else. However, they looked at sport risk and joint involvement, and then they came up with some factor recommendation ranges. So this is where it gets a little bit interesting. So you can see that amongst 9 people, there was quite a wide variation in recommendation about how high factor levels should be while participating in a variety of different sports. So this first slide is in individuals with joint damage. So in these recommendations, they looked that factor should be as high as 65% in high risk sports, but as low as, I think it says 47%. I am wearing my contacts. So that's a pretty wide range, even amongst 9 people making these recommendations. It was a similar thing that we saw for individuals without joint damage. So this just demonstrates how wide a difference there is between what people believe is protective for sport. So what the heck do we do about Hemlibra? So we theoretically, we know we can't measure levels the same way, but theoretically we're thinking people are around a steady state of maybe 20%. We don't really know that perfectly. We're sort of assuming that's, I say this in quotations because this is not totally true, but the idea is that we're sort of converting these patients similar to patients with mild hemophilia. In my clinic, we don't give prophylaxis to patients who with mild hemophilia who play sports. We let them play sports. We talk about safety. If they bleed, we treat them. Maybe some other clinics are different, but that's what we are currently doing at our clinic. And all of this evidence is currently anecdotal with varying approaches between centers. So what I talked to several people in the United States about this to try and get a sense of if people are what they're doing at centers that have had more experience with Hemlibra. So some people are treating with Hemlibra in their off season and then switching to factor for their on season. Some people are just staying on factor and not even going on to Hemlibra because they feel that they do better if they have those peaks when they are playing their sport and they don't want to risk having a bleed with that unknown of the factor level. And some people will be on Hemlibra, but then have a factor plan if they do have breakthrough bleeding. So there's not really one strategy that people are using. Okay, but seriously, what do we do? Give me some answers, Julia. I don't have any answers. At this point, there's really no scientific evidence to inform our decision-making around how we manage our high-level athletes or our athletes in general. Each clinic and each patient will have to decide what is best path forward for each of those people, with some potential unknowns and some potential maybe we're going to have to reevaluate if something changes. The most important thing, as we do with all hemophilia care, is individualization and personalization. Know what your patient's goals are, discuss the possible pros and cons of different choices, have a plan for different scenarios. If you bleed or if you start having repetitive bleeding while you're on Hemlibra, do we switch back? And be flexible with alternating that plan. Now, I think the more important person in this talk is Patrick, because everybody knows that the patient is the most important person in this scenario. So Patrick is going to come tell us his experiences being an athlete on Hemlibra, and I'm really excited to hear about it. So please welcome Patrick.
Sorry for the ranting. I think this guy had an impressive beard. Anyway, good morning, everyone. My name is Patrick SYRIANI. I'm a severe type A hemophilia. I'm coming from a very physically active family, so it was quite a challenge for me to play sports and compete in sports while dealing with hemophilia. And of course, well, I competed in many sports that are big no-nos like basketball or karate during high school. Well, I have to live with the bleeds, the numerous bleeds, especially on my elbow and my ankle. Something important to mention is that although I am severe hemophiliac, I'm lucky, I guess, to not bleed as much and as easily as some of my peers. So it's sort of camouflaged my disorder. So once I reached university, I had a kind of a downfall. I stopped all sports, gained a significant amount of weight until about 10 years ago when I said enough was enough. And since then, my relationship towards sports changed significantly as I practice and compete with purpose, mainly in Olympic weightlifting, as you've seen my lifts. Training took a toll during COVID, and I started feeling significant pain in my ankle to the point of which I had trouble even walking sometimes. My approach since then changed with the goal of maintaining my mobility past the age of 70. And I'm pretty sure the treatment we have right now is a step towards that. And also I transitioned into road cycling. I had some slides here, but enough bragging about me. I think the lifts were enough. Okay, so let's talk about the main subject here. So now, although I've been on Hemlibra for 6 months since last November, I can definitely see a difference between factor-based versus imicizumab. Personally, the main issue and cause of my joint bleeds was due to frequency every day. And now well, punctuality has always been a challenge for me. So of course I had sometimes to skip treatment, and for obvious reasons, those were the times I had my joint bleeds. Anyway, so with Hemlibra, I know I get treatment once a month. That's what I opted because it's the easiest for me. And I noticed from a coagulation perspective that a significant improvement when I have scuffs or whatever. And I haven't had a joint bleed since. So knocking on wood. So at the end of the day, I have peace of mind. I get my treatment once a month. I forget about it. I can ride 300 kilometers on the bike and not worry about bleeding. So thank you for that.